I think it was the roller coaster of emotions. And I think most of the people there with me, most of the doctors would have said the same thing. You go through this moment of a little bit of disbelief to this all makes perfect sense to now I'm mad because nobody told me this before.
You're angry as a provider. You're like, why do we not already know this? How many people could I have helped, including my own children? And it's too late now.
After I learned from the seminar everything that was taught there, I was more hopeful than skeptical. But that hope drove me to find out for myself.
It was great. I think it was very eye-opening that, he had the research to back it up. He had the clinical cases to show us. And kind of the quality of life changes that you could also be seen from the treatment.
Research and studies have been done on sleep disorder breathing in kids and the root causes of that. And I really feel like these issues are all addressed with.
Immediately started researching and finding out, number one, is this problem really as big as it's led on to be? And after talking to other doctors, other pediatricians, ear, nose, and throat doctors, and you start to find out that it is that big a deal, and that it's not my kids, just my kids, that are suffering with this, then I was really excited to find out more.
So my eyes were open to so many things that had been coming into my office for a long time that I hadn't been able to diagnose simply because I didn't know better.
From here forward, I can't change what I've done in the past. I've treated thousands of kids with braces, and I can't go back and change that. 3 of my own 6 kids I treated that way, and I was angry at myself for not knowing more than I knew. And now, moving forward, at least there's hope.
I had pulled teeth on kids for orthodontic reasons. I just didn't know better, but I haven't done any since then. So you go forward, right? You can't obtain this information too quickly. It's so exciting to have this paradigm shift in the way that you look at patients.
I just recently had a son. He's 5 months old now. I kind of have that perspective now where I can say, okay, if it was my kid, he was 5 or 4, or later 7 or 8, and we're seeing a growth issue, or we're seeing crowded teeth. Heaven forbid, I'm a dentist. What am I going to do? And hands down, no questions asked, I would put my child through this program. And I think that's the true test of any treatment I can offer.
Aside from all the benefits that it has to offer to children and to our patients, it just makes sense.
I think they need to come see the results that speak for themselves.
Yeah.
Talking to parents of the kids, seeing they change, it speaks for itself.
It is one of the most rewarding things when you have these parents come back to you in just a few weeks' time and with tears in their eyes describe to you the effect that it's already having on one of their children that they didn't know how to help. And when you can be that doctor, it's so much more rewarding than doing the perfect root canal or, even doing nice braces for a kid. That's nice. They have a nice smile. That's a nice service. But it's not as rewarding as knowing that you've helped that child, you've helped their health for the rest of their life. It's a life changer.
That's really it. Honest to goodness, that's what it's all about. There's no false pretenses. There's no trying to sell something that has other motives. This is what's best for these kids.